Hey, good afternoon, everybody. We will get started with the webinar. First off, welcome to the MyARTA Health Hub app webinar. Today, we're going to walk you through the MyARTA Health Hub and demonstrate how to access the new and improved claims portal on the new app. I would like to introduce to you Rosie Borelli. She will be doing the demonstration today. We also have Amanda Shaw, our Chief Marketing Officer, with us today. My name is Jennifer Hope, and I'm the Manager of Marketing Promotions at ARTA. And Amanda and I will help answer any questions that do come in through the Q&A chat. Just a few housekeeping notes. This session is being recorded, and we will be posting it on our YouTube channel. So if you want to go back and watch it at any time, you can visit the ARTA channel and you can watch this webinar again. And for that reason, your microphones and videos have been disabled just to ensure your privacy. And if you do have any questions throughout today's webinar, please use the Zoom Q&A function rather than the chat function, as Amanda and I will be monitoring that Q&A box. So that Q&A box is just the two little speech bubbles within your Zoom menu. And with that, I will pass it on to Rosie, who will start the demonstration.
Thank you, Jen. I'm very excited to be hosting my second webinar this afternoon for our new mobile app. Thank you all for joining us. I'm just going to take a moment here and share my screen, so just bear with me for a moment. Okay, perfect. So let's get right into it. So you can easily download the app from our app store. Once downloaded, we will click on the app. And it will ask you if you want to use your location. I would always recommend saying allow using the app, just because when we get to the Find My Provider feature, your location services do need to be enabled. From here, we're just going to hit Let's Get Started. And then it'll ask you if you are the plan member or the dependent. We will select plan member and then hit continue. And then sign in and continue once more. From here, we're going to log on to our MyARTA account. If you're not already registered for a MyARTA account, you will need to register for an account, which you can do so below. But since we are registered, we'll click sign in. This redirects you to the MyARTA Health Hub, and it can take a few seconds. The next thing that will populate for you guys is a guided tour. We will do the guided tour here quickly. So all you'll do is press on Let's Get Started. It will direct us to where our health services are located, our profile and settings, and then some quick action icons such as submit a claim, check coverage, and book an appointment with a doctor. It will also ask you if you want to enable Face ID. Personally, for myself, I will say yes. And then the first thing we're going to do is submit a claim. We're going to do a few different types. So as you can see, there's a big blue submit a claim button on the top of the screen. So we're just going to hit submit a claim. Then it will ask you who this claim is for, a member or spouse or any dependents. For this particular claim, we're going to say that it is for Phoebe, and we'll hit continue. Now you'll get an area that says, what is this claim for? You have the opportunity to search for what you're looking for, such as massage, and it will populate, or you can scroll down and find massage on the alphabetical list. Once we found that, we'll hit select and then continue. Next, you'll select your provider. If you've made a massage claim in the past, you might see a provider under the recently visited providers list. If this is your first massage claim, or if you've recently switched to a new provider, you can simply use the search bar at the top of the page. You can search by phone number, the last name of the provider, or the provider's business name. and they are all listed right there. However, you do want to keep in mind that this function lists providers from across Canada, so we want to try to be as specific as possible. If your provider has a common name or if the business has many locations, you may need to search through the list to find the ones you're looking for. So an example of this is if we were to type in the provider's last name, Jackson, we can see that it has pulled providers from all across Canada, such as Ontario. There's some from Edmonton here, and the list just keeps going down. So that's why we do suggest using that phone number. So if we exit out of there and then we click on the phone number option and we type in our provider's phone number, this has narrowed down our search results to all the providers listed under this business, and then we can very easily find our provider, which is R. Jackson. However, if you can't find the provider you're looking for, and let's say you're searching and you can't find any provider, you can simply click Add as a new provider, and you can provide all those details. However, for this example, we were able to find our provider, so we will continue with them. Next, we need to indicate whether you have an additional source of coverage. Additional coverage does not include any provincial coverage, but would include an employer-sponsored or spouse's plan. I'm going to indicate no. Next, you need to indicate if the claim is related to a motor vehicle accident or a workplace injury, which I will also indicate no. ARTA does not require any prescriptions or paramedical services such as massage or physio. So in this area, you can indicate that you do not have a prescription as one is not required. Perfect. So finally, we can select the treatment date, the length, and the total cost of treatment. So for this treatment, we went on May 1st. The length of the treatment that we received was 60 minutes, and the total cost was $85. And then we can hit continue. You can make multiple claims at the same time if you have multiple claims to make through the same provider. Simply just press the Add Another Purchase button and you can fill out those details as well. So we'll say we needed to make another claim here for the same amount of treatment length and the same total amount. We just went to a massage on a different day. We can save those changes. And as you can see here, now there's 2 massage therapy claims underneath that same provider. However, if by mistake you end up doing this, you can simply click on the 3 dots up top and then click on Delete Purchases. It'll ask you once more if you want to delete, and then it will be removed. We will then hit Continue. This is where you'll have one final opportunity to confirm the details of your claim before hitting Submit. So we'll just make sure everything looks good here. And of course, you can always use the drop down to see what answers you said no to, and then the actual purchase. So we'll hit Continue. And then we will accept the terms and submit the claim. So we have now submitted a massage claim. And as you can see, if we click View Claim Details, that this was updated live with information regarding your claim. This is an example of ARTA's real-time adjudication, which allows you to see the results of some of your claims immediately. Not all claims are adjudicated in real time, though, depending on the complexity of the service or item being claimed. Many claims still need to go through the standard adjudication process. We will now look at that standard adjudication process. So if we click the X on the top left corner, we can then simply quickly go into Submit Another Claim. And it will take us back to the beginning steps of who we're wanting to submit this claim for. This time we are going to be submitting a claim for Johnny. And we are going to want to submit a hearing aid claim. So we will click on the box here, and then we can find on our alphabetical list hearing, and then we can see hearing aids and earplugs, and we will simply click on the hearing aids, and we can hit select. and then we will have to hit continue. We will now search for a provider. So this time I am going to search by the business name. And as you can see, again, it did pull from all across Canada, different Hearing Life locations and providers registered to those Hearing Lifes. So to narrow down my search results, I will have to be searching by phone number. So I'll simply type in the phone number. And then as you can see, it did pull up just the one location, which we can click on. If at any point you encounter difficulty locating your provider, you can also easily skip provider search. So to do that, I'm just going to type in something that will populate that for me. And you'll just click that button right in the middle, and you'll skip the provider search and you'll be able to upload your documents right away. But in this case, since we have found our provider, we will continue. So again, like before, we will need to indicate if we have an additional source of coverage. And then next indicate if this claim is related to a motor vehicle accident or workplace injury. And then at the top of the page, below the attached receipts or documents, you can see a text that reads, "A prescription is required only for your first hearing aid claim through ARTA. Once your claim is processed and paid, future claims won't need a prescription. You can upload this prescription in the additional claims details section below." So this is just a message to remind you that you may need to upload a prescription. So we can upload a file and find where we have our saved paid hearing aid receipt and prescription. So if we click on upload a file, it gives you 3 different options. Number 1 will be select a file, take a photo, and select a photo from the library. For this example, I'm going to be selecting a file. So I'll simply click select a file. I'm going to find my hearing aid receipt, and then I'm going to click upload a file again and select a file, and I'm going to find my hearing aid prescription. As you can see, they both have been uploaded there. And if you do end up adding one that needs to be removed, you just simply click on the remove button. You also are free to provide any additional information required for your claim in the notes section. However, this is completely optional. For this example, I'm just going to state that this claim is for Johnny. And then we'll click continue, and then we will review the claim. Again, it does give you that one final opportunity to make sure that all of the details in your claim are correct and accurate. And we can hit continue. And then we will accept the terms and submit the claim. As you can see here, the hearing aid claim has been submitted and it's currently being processed by ARTA's adjudicators. So this time we're going to hit the button done. And it brings you directly back to your claims history. However, we're going to go back to our home page and we're going to go to the blue button, submit a claim again. And this time it'll be for Johnny. And what this claim is for is we're just going to look up how to do a drug one. So we're going to click drug for prescription and then drug again and then continue and continue once more. We'll answer those standard questions. So we're going to hit no for the additional coverage and no for the motor vehicle accident or workers' comp. Here, it will bring you to just an upload file. So if you ever go to a pharmacy or if your pharmacist is not able to direct bill, you can then simply take photos of your receipts and upload them here. You don't need to take a photo for every separate pharmacy receipt. All you would need to do is upload those receipts there, and then the claims adjudicator would be able to put them in individual claims for you. And we're just going to cancel that. And we're going to go back to our home page. And we're going to submit one last claim. for Johnny. And this claim here is going to be for dental. So we're going to click on the dental. And as you can see, this has populated numerous options for dental. When you submit a dental claim, you do want to be submitting under dental services. However, you can see that there's a dental estimate for services option as well. This is when you need to submit a predetermination for an upcoming dental service. ARTA always recommends submitting a predetermination for anything over $300. So we are going to click dental services and then select and then continue. Here, it does populate my recent provider for my dentist. So I'm going to leave this because this is what will happen to you guys as well once you do start putting in those providers. So this looks correct. This is my current dentist. I'm going to hit continue. Again, the standard questions, asking if I have additional coverage, and then the motor vehicle accident or workers' compensation. So for when you get to your dental claims, to be able to fill this out correctly, you will need to look at your standard dental claim form, which your dentist office would provide you, which would give you a list of the procedure codes and two service codes that they did use during the procedure. For our example, I'm only going to be submitting 1 unit of scaling. So I'm going to pick the date, April 29th. The procedure code I do know. And then the dentist fee, I'm going to go off of the fee guide. And there is no laboratory charge for the scaling. Once that's all filled in, you can simply click continue. And as you can see up top, it does register that that procedure code gave scaling for 15 minutes. Now, usually when you go to the dentist, you do get more than just the 1 unit of scaling. You do get multiple things done. So you can simply click the add another purchase. And we can say that we did get more scaling done. And the laboratory charge again would be 0. And then save changes. And then that would populate numerous claims for you, but we're just going to click those 3 little dots and we're going to delete this purchase and then delete, as we're just going to process the 15 minutes here. So we'll hit continue. One final opportunity to make sure everything we are submitting is correct, which it does look like that. And then we will accept the terms and submit the claim. Perfect. So there are 2 ways to look at your claims history. So there is the claims tab. As you can see at the bottom of my screen, there's a home, a services, a claims, and a coverage. Anytime you want to look at your claims history, you can click on the claims button. But also, if you click on home and you scroll down a bit, you can see view recent claims. And if you click on view all, it does take you directly back to this tab as well. After a claim has been submitted, you'll be able to view it in your claims history. As we can see all those claims I had just put through, we can see them there. And you can view the claims from the previous 12 months. We can see our recently submitted claims are in progress, but we can also see previous claims that have been put through on this test account. So we can click on one, and then we can click on this download button right here. And this will populate our claim statement. You are also able to then click, and you're able to easily print and mail or message the statement to anyone that you choose to. You also have the opportunity to ask a question when a claim has been processed, denied, or in progress. You simply just click the Ask a Question button, and you can type in your question here. This question goes directly to our email address at info@arta.net, and one of our member service administrators will respond to you as soon as they can. So then we'll just hit submit here. And as you can see, the question has been sent, and it goes directly to ARTA. Perfect. At the top right-hand corner, you can also see a filter button. So we can filter for specific claims. So we'll click on that. And let's say that we are looking for a massage claim. So we are going to want to look under claim type. And we are going to want to click on the select all. And then we're going to want to scroll down to massage. Once we click on massage, we can click the exit button. And then we will go to the member's name because we just want to be searching for Phoebe's massages claims. And we can click the exit button again, and we will leave paid to yourself or the health provider because we want to look at both. And then we can click apply, and we can see all of the claims that have been processed or currently in process for Phoebe for massage. And then we can simply click the filter button again. And we want to clear all the filters. So we click clear all. And then we do need to click the apply button again. And it will go back to all of our claims. We're now going to go over to the home page. And we're going to scroll down to find a health provider. And we will click on find a provider. Find a provider feature allows you to search for an accredited provider in your area. By doing this before making an appointment, you can ensure the providers are approved by ARTA and even check if they've arranged direct billing. So we are going to use massage therapy as our example. So we're going to scroll down and find massage therapy. And as you can see, it has given us a list of all the massage therapists operating in the area you are located. You can see their address and phone number and an icon that says whether or not they direct bill. And if a provider has a website, that URL is also listed, as you can see there. You can also click on the map. And this will show your current location. If the map is not displaying your current location, you will need to turn your location services on in your phone settings. Like I did mention at the beginning of our session, you would find this under settings, apps, MyARTA Health Hub, and then ensure that the location services are turned on at least while using the app. We can change the zoom level by using both of our fingers to zoom in and out. And this will change the results that appear on our list as well. So if we're not wanting to look for a massage therapist close to home, but close to, let's say, your favorite restaurant, we can then go and look in that specific area. Okay, and if we click the back button here, it does take us back to the list of those providers. We are also able to search for a specific provider. You can add those details in the search bar at the top, and you can search again by the provider name, the business name, or the phone number. So you can see here it's by search by, and this time we're going to search by phone number immediately. So we'll click on phone number, and then we want to apply. And then we want to search up top the phone number. Perfect. And as we always recommend using those phone numbers as they do provide the most specific results, as you can see that this phone number did generate all the massage therapists underneath this specific business. You can easily click on them, and you do have the ability to call. It will direct you to their website as well. And if you click on the address, it will open up your maps and take you directly there. Perfect. So the one last thing that I do want to show you is, again, we have a filter button in the top right-hand corner here. And if we scroll down, it does give us the option to search for a delisted provider. So delisted providers are those who have closed their businesses, moved to a new location, or are under review by ARTA's claims adjudicator. If you use a delisted provider, you will not be able to make a claim for those services. So as you can see, it does give you a list of them. Perfect. So I'm going to go back here to the home page, and we are now going to go over check coverage. So there are two spots you can go to when checking coverage. If you go to your home page and scroll all the way down, it'll say do more with your claims, and you can click on the button to check your coverage. However, we do have a check coverage button. So on the bottom of my phone here, you can see the coverage button with a heart. If you click on that, it does take you directly to the check coverage. So this page will allow you to check both the type of coverage you have through your ARTA benefits and the remaining balances you have in each category. Your eligibility may look a little different than the example I'm going to show you, just depending on the type of benefit plan you have. So in the middle of the page, you will see a search bar that allows you to look for a specific type of product or service. So we can simply just search massage, and you can pull it up there. We can look in the alphabetical list. And then if we click on something such as medical imaging and testing, there are, oh, my mistake, sorry, medical supplies and equipment. There are more categories within this category. So as we see, if we click on garments, casts, and braces, there are more options. However, for this example, we are going to stick with massage. And once we look at massage here, we can put in the information. So the service date, the duration of the massage that we're going to go to, and the amount estimated that we are going to spend at the massage therapy place. For this massage, we are going to say that it's going to cost us $110. And as you can see, there is a disclaimer stating that there's no prescription required. Under check coverage, it will let you know if you do require a prescription or not for the services or items that you do check. So once you're ready, you can click on check eligibility. And then as we can see here, this page will give you a breakdown of what you can expect from your coverage in this category. You can see the cost breakdown, and then you can also click on view details to see the detailed summary. And then you can also click on view details and see the available balance. So we can see that we have currently used $175 for our paramedical practitioners for the calendar year. We can see the amount that is remaining, and we can also see when it is eligible for renewal. ARTA's calendar year for paramedical practitioners does run January 1st to December 31st. So that's why you do see that January 1st, 2025 as eligibility for renewal. We do have the ability to submit another eligibility check button, and we're going to click on that, and it's going to take us back to the check coverage page. We are going to do one more check coverage. We are going to look under drug. So you do have the opportunity to check coverage for specific drugs that you're curious of eligibility on. You have the option to check by drug name or by the drug identification number or DIN number. For our example, we'll start with using the drug name. We'll simply type in trazodone and hit continue. As you can see here, it does populate many different doses of trazodone. If you are looking for the specific dose that your physician had recommended for you, what you can do is then search by the DIN number, and we will put that in there. And then this will populate the DIN with the specific dose. So again, we will do one more example of this. We'll do it for Phoebe. And we will search by the drug name to begin with. And we will search for metformin. And we will hit continue. And that's my fault. It should be drug name. Let's try this again. And as we can see here, we searched under that broad name metformin, and it did bring up several strengths. And then if we search by that DIN number for metformin, it does bring up the specific dose. This is a great tool to use if your physician is recommending a new medication and you're wondering if the ARTA Benefit Plan will provide coverage for it. You can always get the DIN number also from your pharmacy. Perfect. So we're going to go out of there and we're going to go back to our homepage. And we're going to scroll down once more to where it says View Personalized Claim Forms. We're going to go Select Form. We're going to do the General Submission Form. You do also have the option to download the Dental Claim Form. We're going to hit Continue. It will ask who this claim is for. We're going to say it's for Johnny. And then it will download the form. As you can see, the section number 1 here has been pre-filled in just to make submitting claims easier. So if you do decide not to submit claims through the app and you want to simply print off this form and mail it or email it into us, you're more than welcome to do that as well. And if you click on the bottom left corner here, you do again have that print option very quickly there.
Rosie, will you re-show all of the attendees how to view their claim statements? That was a question that came in, so if you can just re-demonstrate that one.
Yes, of course. So if we just go back to, we're on our homepage now, if we go to claims, this populates our claim history. If we scroll down, we can see that this scaling for 15 minutes for Phoebe has been processed. We will click on that. And then there's this big download button here. If we click on download, it populates that claim statement right away. You can't see your claim statement until the claim has been completely processed. Or another example is if there was a denied claim, you then can view the claim statement as well, showing the denial, and the explanation of benefits will show why it was denied. Hopefully that can clear it up for anyone.
Thank you.
However, I will turn it over to you, Amanda, for a moment, who will briefly go over the health services offered on the MyARTA Health Hub.
Yeah, so one of the things ARTA is very excited about with the new MyARTA Health Hub is it integrates your telemedicine and counseling services directly into the app. So every extended healthcare plan offered by ARTA includes access to telemedicine and online counseling or health life transition coaching. You can access these now directly through the app. Our primary plan members can see all of their details, and here these services were formerly known as Inkblot and Maple, but now they're just rolled right into the app experience. Spouses and dependents can also create their own accounts to access these virtual care services. So if you remember way back at the beginning of this webinar when Rosie logged in and it asked if you're a primary plan member or a spouse or dependent, everyone can download the same MyARTA Health Hub app from the App Store. Our primary plan members get the full experience, and then our spouses and dependents can also set up an account to access telemedicine and counseling. So Rosie's going to show you a little bit of these services that are integrated into the experience.
Thank you so much, Amanda. So all of those health services are going to be at the bottom of my phone here. It'll say services, and you can click on there and you can see all of the health services that are available to you. So for our example, you can see that the mental health counseling is available. So if we simply click on this and then hit the continue button, we can see the counseling is available to us and how many hours of service for a counseling that we have. So this is a test account, so we have used some of these counseling services, but your counseling is 5 hours of individual counseling and 5 hours of couple counseling per calendar year. This calendar year for the Green Shield Health Counseling does run November 1st to October 31st. So it is a little bit different than ARTA's normal calendar year. So just so you know, the first thing that you would want to do when you come on to the counseling is you want to match with a counselor. So if we click on match with a counselor, you are then able to start making your perfect match. You do have to fill out a questionnaire that helps you match to the best counselor for you. After you have matched with your counselor, you do have the opportunity to have a 15-minute session with them just to get to know them a little bit better, and make sure that they would be a good fit for you. At the end of those 15 minutes, if you don't feel like that's right, you are able to move on and pair with a different counselor and use another 15 minutes. Those 15 minutes do not count towards the 5 hours of individual and 5 hours of couple counseling you get, because we do want to make sure that you have that 15 minutes to form a great relationship with your counselor. So I'm going to cancel out of this one, and we're going to go into telemedicine, and we'll hit continue. Again, since this is a test account, I'm sorry I won't be able to show you this aspect, but what will happen when you click on telemedicine is you'll have the opportunity to book a consultation with your physician. Once you book a consultation with your physician, you are able to discuss, let's say you have a flu and you just want to talk with someone about it. You're more than welcome to do that. You also have the ability, the physician can write prescriptions for you and make referrals on that front. However, this is only to be used if you don't need to, of course, go to the emergency room. And then for the work, health, and life services, we'll click on that and hit continue. And again, unfortunately, because this is a test account, I'm not able to show you. If you do have any questions or concerns about the telemedicine or work, health, and life services, you can drop your email in the question and answer box, and I'd be more than happy to reach out with you and go over those services for you as well. Okay, so now we are going to go over, if we click on the top right-hand corner of our home page, there's a little card icon. So this will display your ARTA benefit card. You can also flip it over to the back and you can see your listed dependents on this card, but you can also see ARTA's travel provider information and their phone numbers. So you can also very easily add this to your wallet. So I will show you this in this example. So if we add to the wallet, and then we're just going to click up top and we're going to click add. It has now been added to our Apple Wallet. So if we go out of here and we click wallet, we can see that this card has been added to our Apple Wallet. So it's very easily for you to take it to your pharmacy. And then what will happen is you may be wondering, why can't I see my dependent information on there? It's because you do have to click those 3 little dots up at the top right-hand corner and go into past details. And then your dependent, so as we can see, Phoebe is listed here, and any dependents you have on the plan will be listed there as well. And then we can just click open and it'll take us right back to where we were on the app. So that is a very amazing feature that we do have. So we'll simply just close that off. So I also now just briefly go over some features in our account settings. So on the top right-hand corner, if we click on the profile button, we can very easily access any personal details. So if we click on profile, all of the personal details are found there. And then if we click on dependents, we can review our dependents and see, make sure all their information is correct. And then if we go down a little bit, we will find something called support. So from here, you're able to easily call us. The first number is ARTA and will go directly to us for any questions. And the second number you will call if you have any questions or concerns with the health services app, logging in or anything like that. There's a phone number that is connected that will provide you with support as well. The next thing that we're going to do is if we click on the Help Center, this will direct us on a new Safari window. And you're able to find numerous helpful articles here on how to navigate the MyARTA Health Hub. So we can click on getting started with the MyARTA Health Hub. And let's say we want to learn how to navigate the dashboard. There is an article that states that. We can also quickly go home by clicking on the MyARTA Health Hub Center again, and it does take us home. If we click on insurance and benefits, you can see that there is frequently asked questions, such as when will my claim be processed? If we click on that article, we do have an answer on when the claim would be processed. So I highly recommend using this tool if you do have any questions regarding the MyARTA Health Hub. However, if you do require further assistance while using the MyARTA Health Hub, you can always give us a call at 1-855-444-2782 or email us at info@arta.net, and one of ARTA's member services team members will be able to assist you. Thank you so much for taking the time out of your afternoon to allow me to guide you through our new MyARTA Health app. We will continue answering any questions you may have, and please feel free to continue to drop them in the question and answer chat. Thank you.
Thank you, Rosie. I don't see any other questions coming in, but we will stick around a little bit to answer any ones that come in a little bit late. But if you don't have any questions, thank you for joining us today. And just a reminder that this webinar will be posted on YouTube in the ARTA channel. So we'll try to get that up by tomorrow afternoon. Again, thank you very much for joining us, and great job, Rosie.
Thank you.